The burden of medical expenses is exerting huge pressure on Kenyans who are now grappling with the rising cost of living. The report released by the Ministry of Medical Services indicates that households spend up to 35% of their expenditure on healthcare alone. The survey further indicates that more people are seeking outpatient services, and expenditure had increased from 1,800 per person in 2002 to 1,900 per person in 2007.
The number of Harambes being held in town, in all parts of Kenya, for people to pay for the health care of people with these diseases is enormous. And what we'd like to do is to reduce this out-of-pocket expenditure by you and I by extending health insurance to all people, both inpatient and outpatient, and covering all diseases.
Currently, government provides inpatient insurance services which amounts to 10% of the bill only, locking out many Kenyans burdened by the high cost of outpatient services.
It doesn't make sense in this day and age for us in government only provide insurance for inpatient care. We must, today and not yesterday, not tomorrow, make arrangements for covering outpatient care. That is when we shall be giving services to the poor.
Nyongo says the National Health Insurance Scheme Bill is currently at the cabinet stage, after which it will be tabled in Parliament. If and when the bill becomes law, all Kenyans under the NHIF scheme will be able to access insurance cover for both inpatient and outpatient services. So far, only 10% of Kenyans have had some form of health insurance cover.
If you are richer, you can have private insurance, like we in Parliament, which gives you access to both outpatient and inpatient care. Now, that definitely is a very skewed society, where only those who have access to money have access to insurance.
Due to the current food crisis, the government has been forced to spend more money on emerging diseases, straining the already overstretched health budget. However, despite being a signatory to the Abuja Declaration that requires countries to spend 15% of their budgetary allocation on health, Kenya spends only 6%. According to the report, that's why HIV-positive individuals spend up to 19,000 shillings for treatment of opportunistic illnesses and ARVs. Still, healthcare facilities are few and far in between. The National Health Accounts Report indicates that the government is spending 71 billion shillings on medical expenses, while the number of Kenyans falling sick seems to be on the rise. Sylvia Chebet, Citizen TV, Nairobi.